All right, U.S. Health Secretary Robert F. Kennedy Jr. joined Texas Governor Greg Abbott in Austin today to celebrate the passage of Make America Healthy Again legislation. Now, the bills that Governor Abbott signed into law restrict synthetic food additives in school meals and require clear nutrition labeling.
Whatever you're Democrat, Republican, whatever the case may be, every legislator in Texas wants to see Texas to be put on a pathway to be healthier. And these laws that I'm signing today chart that pathway.
The legislation also does not allow people to buy sweetened drinks or candy with the Supplemental Nutrition Assistance Program, or SNAP. Secretary Kennedy says this MAHA plan for Texas is a model for the entire nation. Meantime, back here in California, lawmakers will decide this week whether a bill to ban harmful ultra-processed foods from school lunches moves forward or dies in committee. Supporters say it could transform the health of millions of kids across the Golden State. Joining me tonight is Kelly McKenna. She's the CEO of End Chronic Disease. She's leading the push behind Assembly Bill 1264. Good to have you, Kelly. Thanks so much for being with me tonight.
Thank you, Marla. Great to be here.
Let's just start off with what Assembly Bill 1264 does.
Yeah, so 1264 is this historic piece of legislation. Essentially what it would do is, for the first time ever, create a legal definition for ultra-processed foods. And then from there, they would mandate that a scientific advisory committee identifies what are the most harmful of these ultra-processed foods. And then they would ensure that those most harmful would be banned from being sold or served in school lunches. And so what are ultra-processed foods? These are highly, highly processed, very addictive foods. They have loaded with chemical additives, added salt, added sugar, added fat, wreak havoc on the metabolism, fueling chronic disease. These were originated in our country decades ago when you had food companies hiring tobacco scientists to come make their foods more addictive. So they drive diabetes, obesity, metabolic dysfunction, behavioral issues, learning issues, reproductive issues, really poisoning our children. And so this bill would be a critical step in helping the health of Californians at school. So California serves 1 billion school meals over the next year. 1 in 5 Californians facing food insecurity. This is a critical bill.
Okay, you just went through a lot right there. About the legal definition, I believe you said a legal definition of ultra-processed foods would still be hashed out. Do we have a definition of an ultra-processed food just yet?
There's no universally mandated definition.
Okay. Okay, but we were seeing in these images for the school lunches, we were seeing, you know, chicken nuggets, French fries, and we're seeing more of that here. It looks like a ham sandwich of some sort, hot dogs. What would these be classified as, those harmful ultra-processed foods?
So the particularly harmful hasn't been identified yet, but yes, these are the kinds of foods that generally conceptually are considered ultra-processed.
Okay, very good. Now, critics, though, of AB 1264, they say that this could lead to, depending on what ultra-processed foods would legally mean, this could lead to arbitrary bans. And they argue that, you know, at this point, we don't know what that would look like, and this would hurt California farmers, for instance. What do you say to that?
So the California farmers have been a critical part of the conversation, and the coalitions and lawmakers who are pushing this bill forward have been very actively in conversation with the farmers to ensure that it does not hurt them. In terms of arbitrary bans, really what this bill is meant to do is protect health of our children. Chronic disease is the #1 most urgent crisis that our country faces, and we won't survive as a nation if we don't address it. So all this bill would do is identify the absolute most harmful that are scientifically showing to be extremely damaging to these children's health, and ensure that they're not being served or sold in schools. And this would be done in a way that doesn't burden schools. It would be on the vendors to make sure that they're in compliance.
Okay, do you have the votes to get it out of committee? And then after that, that would be the next step of having the votes of the legislators?
So the votes are looking good. This bill has already passed 6 different committees, and so far the votes have been almost unanimous in every committee. And so, as you said, it's in the Senate Appropriations, which will be on Friday. From there, there's only 2 more committee votes to get it to Governor Newsom's desk. So I can't say for sure what will happen on Friday, but I would say the track record so far is looking good. And even since the last committee vote, there's been more negotiation to make sure that everyone's in alignment.
All right. Well, End Chronic Disease, your nonprofit, you've helped pass 25 bills across 12 states, and just this past year impacting more than 60 million kids. You've done so in red and blue states, so you've been able to work across the aisle. So kudos to you. If you'd like to join Kelly in the fight, check out the End Chronic Disease website or their social media feeds. Kelly McKenna, CEO, thanks so much.
Thank you.